So it's been 2 weeks since my surgery. I just wanted to make a video about what I kind of went through after surgery, because it was a little bit, in many ways it was different from my surgery in November. The one thing that stood out the most at the time, like the day of and the day after surgery, was I was in way less pain. Not sure why. I think I might have touched on that in my vlog, but the pain I experienced during my first, or after my first surgery in November, was just like, it just felt like my, it's gonna sound gross, it felt like my skin was like ripping apart every time I moved. Gross. Ow. Because I don't know, like I think it was the night of, I actually asked Ashley to go get me a cane from the drugstore to help push me off of like the bed and stuff, or like getting into bed, like lying down carefully. That was mostly why I needed it. And then other than that, just kind of giving myself balance when I was walking around. So that wasn't pleasant, but that was in November. When I was recovering in the recovery room, I was in there for an hour and a half. So that was a little bit longer than the one the time before in November. I was in there for only an hour. But anyways, I was in pain in the hospital. It was bearable to a point, but I was also taking oxycodone for my pain, my narcotics for my pain medication. And that was kind of helpful too. So there wasn't many times where I'd have to take more than 4 a day, or maybe even less. But the thing I wanted to sort of touch on in this video is then what happened after the next few days. So if I had my surgery on Wednesday, 2 weeks ago, I started experiencing different signs of like sadness and depression for the next week or so. Now, I already do suffer from depression in general. Like, I take Zoloft as my main medication for depression. So it wasn't unusual to be depressed anyway. It might have just been like one of those like heavy depressive episodes, and I was just experiencing it at a bad time. But when I went to go see my therapist, actually we made an arrangement to see each other on the Easter Sunday, just so I could kind of wrap my brain around things, because I was just getting over the biggest part of the depression then. I'll go into more detail about what happened, but she had explained that there's a very common side effect of post-op surgery, especially going under general anesthesia and just being out. A lot of patients just suffer from depression after their surgery because there's a concoction of drugs that go into the making of your general anesthesia. So what the anesthesiologist is looking for before they put you under, or they ask you to come in and do a post-op appointment with them before you go into surgery, because they need to know a few different factors about your general health and how you might have already reacted to general anesthesia. So for me, I didn't have to go in I didn't have to go in to see an anesthesiologist because it was only 6 months prior that I had already seen one, so in November. But I didn't have to go see another one for this one because my doctor and I didn't see it was necessary. So what the anesthesiologist is looking for are allergies, how you may have already responded to general anesthesia medication before. They want to know what kind of prescription medications you might be taking already, any supplements you might be taking as well. They also need to take your weight to see and to ask you if you've already been diagnosed with sleep apnea. And another diagnosis they look for is diabetes. They just look for everything. They want to know everything because when you're put under, they need to keep you under. And so they actually have to combine a bunch of different medications into what they call like a concoction for your general anesthesia. So everyone's maybe different. So once you've visited your anesthesiologist and they've taken any notes they need to prepare for the surgery the next few days, they then ask you to fast from probably around midnight onwards until you're done surgery. So when you get to the surgery waiting room, you are met eventually by your anesthesiologist, and they will sort of like take your wrist or your arm or something and look for the easiest vein to put the needle in, and then he's kind of like tape it down. I was put under for the first surgery. They put it in the top of my hand, and then this time they were able to put it, I can't remember, no, it was this arm. They put it in this area here, and then your doctor comes in and blah, 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 talks to you, and then you eventually get led over by a nurse, and then they prep you. So once they've got you lying down on the table in the operating room, they start putting like electrodes all over your body or chest, I think, and then they start to slowly kind of like introduce the intravenous and then the general anesthesia to your arm, it can sometimes feel cold. I find it feels cold, and at the very last, like few, I don't know, 10 some seconds, it starts to feel kind of stingy. And then they also put a breathing mask. I think it was just oxygen on your face, and then you just kind of breathe that in. And then the last part you don't notice while they're prepping for surgeries. They give you muscle relaxants as well. And then once those have like kicked in, they put a breathing tube down your throat. I don't know how far down your throat, but I think it's just about here. I hate the breathing tube because it always makes my throat super raspy and sore. Well, not really sore, just very hoarse. And occasionally they will actually like poke and prod at your throat. Depends on, I guess, how aggressively they want to put the breathing tube down, and you'll get like bruises or like neck or something. And then they do your surgery, and then you are all great, and then the video is over. Congrats! So, no. So then when you wake up, they actually they stop like feeding you the general anesthesia in the recovery room, and you're there probably for about an hour. And then they don't tell you a lot of things before surgery. I've been under general anesthesia 3 times. So the first time, I think it was in 2015, in the summer, I had gone in for Botox. I had gone in for Botox, sorry, in my bladder. So I had gone in for Botox previously, about 3 months prior, or maybe 2 months prior. Just under local anesthesia is where they just numb your bladder, and then wherever your local anesthesia is supposed to be, and do the procedure. However, the nurse who tried to give me numbing solution in my bladder didn't numb me long enough, so it was incredibly painful when my doctor in Ottawa tried to, he injected my bladder wall with lots of 20 pokes of Botox. That hurt like a mother. I did that, and then it didn't work, so we tried doing it again because I was uncomfortable and whatever. So he suggested that we do it under general anesthesia this second time. So in 2015, I had 2 Botox procedures. They typically only last about, I guess the Botox only stays about 6 to 9 months. And then when I went back for my second time to see if it would work better, with the same amount of 100 cc's, I woke up and I was just immediately awake, like as if I woke up from like a regular nap or something. I was a brat. I was in a bad mood, and I didn't want to be there, and there was just a lot of things going on, and I was just pissed off at everyone. I signed it. If you know YouTube well enough, you'd think that AMA stands for Ask Me Anything. I signed an AMA form, which means against medical advice, so I could leave, because I didn't want to stay there for 2 to 4 hours. I think I stayed there for an hour because they like made me, but otherwise I was just like, I need to go. I'm done. Like, I just needed to go. Having a bad day. My mom was there, picked me up. I could have drove. You're not allowed to, but I could have driven. So the second time I was under general anesthesia, so November, and then this month, April, everything went smoothly, and I woke up like they wanted me to gradually and getting used to things, so that was fine. I wasn't like in a bad mood or anything, but that's beside the point. So normal side effects of general anesthesia and surgery normally is just like drowsiness, nausea, possible vomiting, dry mouth, and hoarseness and sore throat, lethargy or sleepiness, drowsiness, whatever. And I was gonna say, of course, pain, but not everyone's gonna feel pain after their surgery, so that can be iffy. But of course, they give you medication if you have the pain that they can subside. So after you've been in the recovery room for a little bit, they normally have a staff member take you out to the actual waiting room where you can see your family or whomever took you there, and you start to they give you coffee, tea, or cookies, so take those because your voice or your throat is going to be sore. And then you just kind of slowly get ready to go. The nurse or doctor comes and sees you, and you basically go home. Like, this is just day surgery. They don't want you there for very long. They just want you to get up and go. So, so that's basically it for the hospital portion. The things that they don't normally inform you about, which I'm going to inform you about, is the post-operative depression that I suffered. That I didn't probably realize I did in November, but I think I did, now that I look back. The depression I felt in November, I attributed to the feeling of the fact that my surgery hadn't gone as well as planned, and then the fact that it was also not, like, my device wasn't working the way I wanted it to. It was working, but not effectively. So what things that can cause post-op depression can be the concoction of drugs and narcotics that they give you during and after surgery. That can really mess with you. Like, there's different side effects people will feel from certain drugs, but in my case, I think that it really hit me hard both times, but like specifically this time. And I didn't start feeling like most people. They didn't start really feeling the full effects of the depression until after they got home. So for me, it was about probably about 4 days later maybe, when I was starting to really feel that pull down, that the lethargy, the general sadness, because it got a lot worse from there. I was really irritable and I would say emotionally volatile, and I wasn't dealing well with it. I didn't know what was happening. I just knew that I had hit a depressive episode, and it was horrible. Wednesday of last week was the day I felt the worst effects of the depression, and it was just horrible. Like, I was just crying all day, and I felt so hopeless and just so useless and worthless and all those kind of words, those less words. And I didn't know how to deal with it, so I just went home from Mississauga and got back home to like the Ottawa area, and then just kind of moped around, and I didn't know how. I was just sad all night. I cried all night. The next day I went out to see a friend, and that helped, but it didn't like solve it, and that's when I had decided to go see my therapist earlier than I was supposed to, and she was able to meet me on the Sunday, and that's when we found out that it could be a side effect of the surgery. So that's very common, like maybe not so intense as I felt, but that's very common for most surgical patients to have experienced any kind of depression. I was actually fortunate enough that didn't last that long. Some cases they end up lasting 6 months after post-op. So post-op depression can last up to 6 months. I already take medication for my depression, so actually it had been increased recently, so I was like, why am I feeling so depressed right now? Like, what's going on? I was actually quite hopeful about the surgery. Like, it didn't really feel like it was weighing me down that much. But it was just, nothing really happened other than the medication, so that's probably what brought me down so hard and so quickly. And then I was hoping that the Zoloft I was taking would actually bring me back up. So I think that's what happened. After about a week or so, started feeling like myself again, but it was really hard to get through, really sucky, because it's so hard to picture yourself or a friend going through that, but if you can, it's basically like a shell of themselves or yourself, and you just are you, but in your head you feel like an intruder, because you're just trying to tell yourself to give up and stop and it's not worth it, and like just all those kind of horrible thoughts that happen. And that's why people don't really talk about it enough. I think the post-operative depression, from what I've heard, is really hard. It doesn't get as well, it's not well documented, because it's sometimes just attributed to the right general surgery itself, and it's not well discussed in the medical field, because it's either not worth treating or it just isn't as important as the actual surgery. So there's just a lot going on. People don't talk about it enough either when they're experiencing with their families. But unless you know why it's there and what it's coming from, it can be really hard, a lot more difficult to deal with, as I found. And yeah, it was just very unpleasant. I felt crappy most of the time I was healing. Physically, I healed really quickly. Like I said, it wasn't very painful. I'm back to normal. I'm feeling great. There are different ways that depression affects some patients, and either it does or it doesn't. Some of it can be attributed to the disappointment of a way a surgery may have gone, or the physical change or scars that can kind of be taxing on your mentality of your physical appearance. And there's just things that come with different types of depression with surgery, which are kind of expected. And that's why I think that some depression is harder to treat when, and some physicians don't really think about it or know what to do when it comes to that kind of depression, where it's just brought on by general anesthesia. So I think it should be more broadcast amongst patients and doctors, and be an open conversation. I'm glad I did go to see my therapist during the Sunday, instead of waiting till actually Tuesday, which was 2 days later. But I'm glad I did talk to her, because it it gave me peace of mind, and kept me at ease, thinking I wasn't like broken or something. And I felt extremely it was a big existential crisis, to put it in that words. Like, I felt like everything was coming to an end. It was very strange. I don't recommend it for anyone, but it's definitely, it just was so hopeless, and I really didn't want to be there. So yeah, that's kind of all I wanted to share. I mean, I feel like I kind of jumped all over the place. If you're feeling this kind of way, it's always good to talk to a professional about it, in my opinion. Maybe just getting your thoughts and feelings heard by someone. That always helps me feel validated, and that it's not just all in my head kind of thing. Not like I ever thought it was, but I really do like to express to people what I'm feeling. So, but not always during the depressive episode. I kind of like withdraw from people and kind of become recluse. Especially that's normally when people, you can tell if I'm extremely depressed. It's because I kind of just leave everyone alone, and I don't do anything, and I get very, very lethargic and physically heavy. I felt that before, where it's hard to keep my head up. Like there's just a, and then another, I think I talked about this in my previous depression video, was that appetite becomes a big thing with me. I don't have an appetite. I lose all appetites for anything. I'll eat out of necessity, but I don't crave anything, and it's kind of makes everything even more hopeless. So, well, that was a fun topic, but I think it's worth talking about. If you have any experiences like this, let me know. We can like chat about it in the comments. Other than that, I'm doing well. Things are on the horizon, looking good, I think. Actually, I haven't shown anyone this device yet. I now have 2 of these guys. So these things, this part, this piece here, can you see it? Goes above your, goes above the skin, obviously. So you put it, say the implant was in my arm, you just put it on the skin, and then you push the buttons on here. So let's see, I'll turn it on now. So this is the InterStim icon device. So I'll put it above my implant. It's only so long, so I'll kind of hold it like this. So then you turn it on. Oh, there we go. And then you push the gray button on the side, and it connects because I'm holding it above the battery. And then you can either change the channels. There's 3. I'm on channel 3. 3, 4, 1, and 2. So right now it's check marked on number 3. So I'm just going to increase it because I can. So there's a button right here. I don't know if I can do both at the same time, but it beeps every time it successfully goes up. And as long as you're holding it above there, it'll connect with the battery and increase the stimulation. So I just increased it 4 times, so now it's at 1.55, which means nothing. The numbers don't need to, it's like a scale. It doesn't mean anything as long as you're comfortable with the device. I actually needed to turn it up, so it's kind of good that I reminded myself to do that, because yeah, I just wanted to play around with the settings and hopefully get a good setting that slows down the overactive bladder symptoms. Anyways, I feel like I've been rambling for too long. Hopefully this video isn't too long and you didn't watch it. But anyways, thank you for being here and watching and following my story. I appreciate all the support I'm getting, and I will see you next time. Bye!